Welcome to the online clinic. We translate complex health science into simple steps you can use today.
Today you learned so much about myocardial infarction, also known as a heart attack, that you can even teach someone.
Sometimes tragedy strikes without warning. A normal day, a normal man, and suddenly he's gone. Today, we bring you the story of a woman searching for answers and the doctor who helps her uncover what really happens during a heart attack.
What really happened to him?
Losing a parent like that, it shakes your whole world. But let's walk through it together slowly. Your father's death wasn't sudden to his body, even if it felt sudden to you. It was something that had been building quietly for years.
It's been building? What do you mean?
The heart you see is like a house that never rests. It pumps day and night about 100,000 times a day.
To keep going, it needs its own blood supply through the coronary arteries. But over time, those arteries can get clogged, a process we call atherosclerosis. Tiny injuries form inside the artery walls from high blood pressure, smoking, or too much bad cholesterol. At first, they're harmless. But as the years pass, the plaques grow, the artery becomes narrow, and the body tries to clean them up with white blood cells. Instead, they form little fatty mounds called plaques.
The blood struggles to pass through, and then, one day, the thin covering over a plaque cracks.
And that's when the heart attack happens?
Exactly. When that cap cracks, the body thinks it's a wound and sends platelets to heal it. But they form a clot to set the process of wound healing in motion. The clot blocks the artery completely, blood stops flowing, and part of the heart muscle begins to die. That's what we call a myocardial infarction. Myocardial means heart muscle. Infarction means tissue death from lack of blood.
So that's what killed him? His heart starved for blood?
Yes, within minutes, the muscle cells start dying.
If treatment isn't given immediately, like clot-dissolving drugs or angioplasty,
It's that the damage becomes irreversible. That's why time is everything in a heart attack.
Does this mean I could have the same thing? He was only 70. I'm 50.
That's a very smart question, Millie. Yes, family history increases your risk, but risk is not destiny. You can change your odds. Let's look at the facts. Worldwide, heart disease kills about 17.9 million people every year.
1 in every 3 adult deaths is from cardiovascular causes like MI.
But more than 80% of those deaths are preventable with the right lifestyle and awareness.
What kind of things increase the risk?
The big ones are high blood pressure, high cholesterol,
Diabetes, smoking, obesity, stress, and a sedentary lifestyle significantly increase your health risks. Even poor sleep and too much processed food and poor attitude to health play a role. So, your father's case might have been a combination of a multiple of those risk factors.
How? You said he worked long hours and ate fast food, right?
Yes. He was always in a hurry, never exercised, always said he'd rest next week.
That's what makes it so tragic. The heart gives warnings in
Chest pressure, shortness of breath, sudden fatigue, but we brush them off until it's too late.
a heart attack is like a thief in the night. It waits in silence and strikes when you least expect it. But there's hope, because knowledge is power.
But please, Dental. Then please, doctor, tell me what I should do to prevent it.
Start with knowing your numbers. Check your blood pressure, cholesterol, and blood sugar regularly.
More fruits, vegetables, beans, and fish. Avoid trans fats, sugary drinks, and processed snacks. Move your body. Even brisk walking for 30 minutes a day helps.
Manage stress through having a healthy social circle, through prayer,
deep breathing, or mindfulness. And never, ever ignore chest pain, even if it's mild or passes after a few minutes.
Heart disease is silent until it isn't. But silence can be broken by awareness, by courage, by change. If you felt something move in your heart today, don't scroll past it. Share this episode. Get your heart checked. And remember, every beat is a gift.